Environmental degradation is estimated to cause between 174 and 234 times as many premature deaths as occur in conflicts annually. A United Nations report says disproportionate impacts of environmental harms are evident on specific groups. They are the poor, the young, the elderly, women, and migrant workers. The UNEP's Healthy Environment, Healthy People report indicates that lack of access to clean water and sanitation causes 58% of cases of diarrheal diseases in low and medium income countries. Unsafe water, inadequate sanitation, or insufficient hygiene result in 3.5 million deaths worldwide, representing 25% of the premature deaths of children younger than 14.
Well, ask the mothers who have to treat their children because their IQ was impacted by lead poisoning. Ask the parents who have buried their children because they died of asthma attacks. Ask the patients who are lying in hospitals and being treated for skin cancer because of what we had done to our atmosphere. Ask all those parents who lost their children before the age of 5 because of water quality. Ask the insurances, ask the taxpayers, ask the governments whether the price that we are paying as a society in the billions of dollars for the pollution that some cause for the many. And I think very quickly people will realize that when we have treaties and protocols and policies, when we promote cleaner technologies, safer chemistry, the conservation and protection of our ecosystems, which in turn sustain us, whether through clean water, clean air, or many of the other products, then very quickly you will realize that it is in our responsibility for also caring for that which we call nature, that we give expression to a human civilization.
Zika, Ebola, MERS, SARS, Marburg, and other new zoonotic diseases which are spread from animals to humans are currently emerging every 4 months, with the main drivers being exponential population growth, intensive livestock breeding, and this is because there are 36 billion domestic animals on the planet, and concomitant disturbed environment and biodiversity loss. Strengthening healthy ecosystems is key to preventing or slowing the emergence of these costly diseases.
What's changed is the way that we both have contact with livestock, our absolute pervasive use of antimicrobials and antibiotics, which is removing and reducing the kind of resistance that we see. And more importantly, is the fact that we have illegal trade of live animals. The fact is, it's happening. And when these animals are somehow transported, they are often released into the wild. Now, because it's illegal, there's nobody signing a sanitation. They're not embargoed, they're not put in quarantine. So these are literally movements of zoonoses moving around the planet. So this is just another compounding fact. On a world that has zoonoses, essentially we're swimming in them. Whether it's because we now envisage it as Ebola or Zika, but in the background we have epidemic zoonoses. You know, we have anthrax, we have pig tapeworm, we have many, many, many diseases. So we have those associated with big epidemics, but then we have a lot of them that are either neglected or just simply there in the background. So very, very important to think about that.
A key need is for greater investment in integrated surveillance of wildlife, livestock, and human health.
When you don't have a good health, I mean, you cannot do much. You are very limited. But if we assure the ways of having healthy environments, healthy ecosystems, then we start talking about providing the means to broaden the opportunities for people to actually start using better the resources and better the surroundings.
The financial costs of environmentally related health risks are generally in the range of 5 to 10% of gross domestic product, with air pollution taking the highest toll.
And if we do not change our consumption patterns, and the consumption patterns leads the production system, if we do not change the consumption patterns, very little can be accomplished. And the change of the consumption patterns is not just to us, governments or international organizations. It's something that has to do with us, people, citizens, the common people in the streets.
Evidence exists, however, of the catalytic and multiple benefits of investing in environmental quality in terms of development, poverty reduction, resource security, reduced inequalities, and reduced risks to human health and well-being. There is growing evidence to suggest that exposure to natural environments can be associated with mental health benefits.
Of course, there are lots of issues when you come in with urbanization and health, but more importantly, urbanization and the environment. It creates lots of changes to the land use specifically. But more importantly, as you look at even air pollution and you think about Africa where we are, with 62% of urban population living in slums, it raises a number of different questions, what is happening within those contexts and within those settings. And we've been able to highlight a lot of the unique vulnerabilities that the urban poor will face, particularly with respect to air pollution, to environmental health challenges, whether you look at water and sanitation and all of this. So the coming together of all this creates new realities that we have to face and work with. So within the region, how are we responding to this? We feel that one of the areas we need to do is to at least create awareness. Awareness at the individual level, because we as humans, it is our action as individuals, as households, as communities, and as nations that is driving the changes that we see in the environment. How do we recognize that? And how do we act at these various levels to take on the right action that can then improve our health within the limits of our environment?
Clean air and water, sanitation and green spaces, as well as safe workplaces, can enhance people's quality of life. Reduced mortality and morbidity, healthier lifestyles, improved productivity of workers and their families, improved lives of women, children and elderly are crucial to mental health. The United Nations reports that mental health issues rank among the 10 largest non-fatal threats in most countries.
Ecosystem degradation impacts both human health and biodiversity. But healthy ecosystems are important in themselves to keep us healthy. So there's a growing literature showing that just having access to nature, just having access to parks, to green areas, and especially now that most people in the world live in urban areas, is critical for our body and mental health. So there's an increasing body of scientific literature on that. For example, showing that in hospitals, patients can recover faster and better if they have access to green areas. So this is quite important, and of course the SDGs also reflect on this, on the goal on sustainable cities. So it's just to say that the interlinkages between the environment and human health are huge, and we need to see the health sector pay more attention to prevention of illness and diseases than they have done so far.
And there is growing evidence to suggest that exposure to natural environments can be associated with mental health benefits. Proximity to green space has been associated with lower levels of stress and reduced symptomologies for depression and anxiety, while interacting with nature can improve cognition for children with attention deficits and individuals with depression. A 2014 epidemiological study has shown that people who move to greener urban areas benefit from sustained improvements in their mental health.